So in last class we have discussed that what is the diuretics classification, general mechanism of action. So today we will discuss about what is the carbonic anhydrase inhibitors and what are the drugs comes under it, its mechanism of action and structural activity relationship. And also for the thiazide, what is the thiazide and what are the drugs comes under the thiazide and what is the mechanism of action and what are its structural activity relationship. Let's discuss about the carbonic anhydrase inhibitors. So this carbonic anhydrase is the enzyme which is present in the nephron, particularly in the proximal convoluted tubule. So means the proximal convoluted tubule, it is a part of the nephron. So in this part the carbonic anhydrase will be present. So what its role means, it will reabsorb the carbonic acid and also the sodium ions. So it will combine the water molecule and carbon dioxide molecule to form the carbonic acid. See here, it is involved in the formation of the carbonic acid from water molecule and the carbon dioxide. Means from the water and the carbon dioxide, it will form the carbonic acid. So this carbonic acid will be dissociated into the hydrogen ion and bicarbonates. So the carbonic anhydrase inhibitor. So the drugs which comes under the carbonic anhydrase inhibitors, it will inhibit the formation of the bicarbonates, and also it will inhibit the reabsorption of the sodium ions, calcium and the potassium and bicarbonate ions. Means it will stop the formation of the bicarbonates and also inhibit the reabsorption of the sodium, potassium, calcium and bicarbonate ions. See here, mechanism of action. The water molecule and the carbon dioxide is combining to form the bicarbonates, that is carbonic acid. So if we introduce here the inhibitors, that carbonic anhydrase inhibitors, for example acetazolamide. So if he introduce the acetazolamide drug, what it will do means it will inhibit the conversion of the bicarb means water molecule and the carbon dioxide to the bicarbonates, and also it will inhibit the reabsorption of the sodium, potassium, calcium and bicarbonates. Here the mechanism is simple just it will inhibit the reabsorption process, that is sodium, calcium and potassium and bicarbonates in the urine. Next, SAR. So it is a heterocyclic structure. So in the SAR, the heterocyclic sulfonamide and the derivatives of the M-disulfonyl benzene is there. So in the carbonic anhydrase inhibitors, these two derivatives are important. Sulfonamide and disulfonyl benzene is important for the carbonic anhydrase inhibitors. So if you see the heterocyclic sulfonamide, this is a structure. In the first position, first position, the sulfur is there. Third and fourth position, nitrogen is there. In fifth position, the sulfonamide group is there. So the diuretic potency and the carbonic inhibitory activity is mainly depend upon the sulfonyl group which is present at the fifth position. See, in the fifth position, the sulfonyl group is there. So it plays an important role for the diuretic activity. Next, the nitrogen atom. If you see here the nitrogen atom in the sulfonyl group, it should be unsubstituted, means it should not be substituted with any other atoms like such as mono or the di-substituted compounds is there, means it will lose its activity. So next one is the sulfonyl. This is a sulfonyl moiety, right? It should be attached to the aromatic moiety. See, this is the aromatic structure. So the sulfonyl group should be attached to the aromatic structure. Next, in the third position, if the methyl group is there means it is known as the methazolamide, and it is used in the treat for the diuretics. See here, I will explain again the sulfonamide. In the fifth position, the sulfonyl group is there, so it is very essential. And here in the sulfonyl group, the amide group is present and it should be unsubstituted. So if it is mono or the disubstituted means the activity will be loses. In the third position, if the methyl group is there means it is named as the methazolamide. It also acts as the diuretics. And this sulfonyl group should be attached to the aromatic structure. So next, derivatives of M disulfamide benzene. So this is the structure of the M disulfamide benzene. So here also same, the sulfonamide group plays an important role for the activity. See here, in first position and the third position, the sulfonamide groups are there. It is attached to the aromatic structure. It is very essential for the diuretic activity. Here also in place of the amide is the unsubstituted. So if it is the mono substituted or disubstituted means the activity completely loses. So the replacement of the additional sulfonyl group at the third position and other electron withdrawing group will yields the diuretic compounds. See here in the third position the sulfonyl group is there. So it is essential for the activity of the diuretics. And here the presence of the halogens like chlorine, bromine or any halogens present in the fourth position. See here in fourth position, if the any of the halogens are there means it will increases the activity. In the fifth position, if the chlorine atom is there means it will decreases its activity. So and in the sixth position, if the amine group is there means it has the more activity and also it can easily remove the sodium and the chlorine atoms from the urine. So I will explain it again. This is the structure of the disulfamide benzene. In the first and the third position, the sulfonamide group is present. It is essential for the activity. And here in the amine group, it should be non unsubstituted. And if it is the mono substituted or disubstituted means it will decreases its activity. In the fourth position, if the halogen groups are there means it will increase the activity. In the fifth position, if the chlorine atom is there means it will decreases its activity. In the sixth position, if the amine groups are there means it will increases the activity and the sodium ions are easily eliminated from the body. Next, in this first drug is methazolamide. IUPAC name is N3-methyl-5-sulfonyl 4-5-dihydro-1,3,4 thiazole leading acetamide. So if we see here structure, so this is the thiazolidine. Thia means sulfur. See here thia means sulfur. Azole means nitrogen. Diazole means in third and the fourth position the two nitrogens are there. So diazole. So come in which positions we have the sulfur and nitrogen? In first position sulfur, third and the fourth position nitrogen. So it is named as 1, 3, 4 diazole. For this thiazole, in the third position the methyl group is there. In the fifth position the sulfonyl group, and in the second position the acetamide group is there. So I will explain it again. This is the structure of the thiazole. See 1, First position sulfur, third and fourth position nitrogen. So 1, 3, 4 thiadiazole, 3 methyl, 5 sulfamide, 2 acetamide. Next properties are, it is a white or yellow crystalline powder, slight in odor. It is soluble in alcohol, water, acetone and dimethyl formamide. Next, pharmacokinetics, it is the oral route of administration and it is metabolized in the liver by using the cytochrome enzyme, undergoes the urine elimination. And adverse drug reactions are decreased appetite, means loss of hungry, nausea, vomitings, constipation, diarrhea, change in the taste, drowsiness, dizziness, fatigue, weakness, and nervousness, means feeling of the fear, and tremors, headache, confusion, increased sensitivity of the skin to the sunlight, means they can't able to expose their skin to the sunlight, and gout, loss of blood sugar. It means in the diabetic patients, if they use this drug, means they won't be in the control of the blood sugar. Ringing in the ears, means tinnitus, means ringing in the ears, and hearing problems, loss of vision, feeling extremeness feeling, and general feeling of unwell and increased urination. So uses, it is a carbonic anhydrase inhibitor. So it will block the protein in the body, that is the carbonic anhydrase. And also it will block the protein that help to reduce the amount of the fluid inside the body. Means it is used to maintain the fluid balance in the body, and also it will reduce the pressure in the eyes, and it is used in the treatment of the congestive heart failures, to reduce the edema, means it acts as the diuretics to treat the congestive heart failure, and the dose 25 mg to 50 mg per day. Next drug is dichlorphenamide. See, dichlorphenamide. In the name itself is there. Dichloro means two chlorine atoms are there. Phenyl group is there. For that phenyl, the amide group is attached. And the IUPAC name is 5,6 dichlorobenzene, 1,3 disulfonamide. See here structure. This is the phenyl or benzene. We can name it as the benzene. See here how many carbon, 1, 2, 3, 4, 5, 6. So 6 benzene in 5th position, and the 6th position chlorine are there. How many? 2. So di 5,6. See here 5,6 dichlorobenzene. In 1st and 3rd position sulfonamides are there. See sulfonamide in 1st and the 3rd position. So it is named as the disulfonamide. So commonly known as 5,6 dichloro and 1,3 disulfonamide. Properties are, it is the white or nearly white crystalline powder. It is a slight characteristic odor, and it is insoluble in water, soluble in alkaline solution, sodium hydroxide, alcohol, sodium carbonate, and also slightly soluble in ether. Means insoluble in water, soluble in sodium hydroxide, alcohol, sodium carbonate, but very slightly soluble in ether. Pharmacokinetics are, it is an oral route of administration and it is metabolized in the liver by using cytochrome enzyme, and it undergoes the urine elimination. Adverse drug reactions are feeling of numbness, change in the sense of the taste, nausea, vomiting, diarrhea, loss of appetite means loss of hungry, weight loss, muscle spasms or tiredness, dizziness or drowsiness, confusion, convulsion, abdominal pain, stomach pain, chest pain, cough, dry mouth, headache, fever, weakness, irregular breathing, joint pain and muscle pain. So these are the adverse drug reactions which comes under this drug. Next uses, it is used to reduce the action of the protein which is responsible for the conversion of the water and the carbon dioxide to the bicarbonates, and also used to treat the glaucoma. Occasional paralysis means loss of the movement can be caused by the high or the low levels of the low levels of the potassium in the blood. And dose, it should take 50 mg by mouth once or twice a day. Next drug is acetazolamide. So this is the structure of the acetazolamide. If you see the IUPAC name N, 5-sulfamide, 1, 3, 4, thiazole acetamide. See, this is the thiazole means, thia means sulfur, aza means nitrogen. 2 nitrogen atoms are there, so diazole. So the structure name is 1, 3, 4, diazole. So 1, 3, 4, diazole. In for this structure of the diazole, in the second position acetamide is there. In the fifth position the sulfonyl group is attached. See here for this is the structure of the diazole. In the second position the acetamide group is there. In the fifth position the sulfonyl group is attached. So this is the structure of the acetazolamide. Next properties are, it is a white crystalline powder and it is odorless, soluble in dilute alkali hydroxide solution, slightly soluble in water and alcohol, insoluble in chloroform, dye, ethyl ether and carbon tetrachloride. So synthesis. The starting material is hydrazine hydrate and it is treated with ammonium thiocyanate. So when hydrazine hydrate is treated with ammonium thiocyanate, so these two structures will be get combined to form 1, 2 this thiocarbamyl hydrazine. So this ammonium thiocyanate and hydrazine hydrate will get combined here to get 1, 2 this thiocarbamyl hydrate. So in the second step, the end product, whatever the end product came in the step 1, that is 1, 2 bis thiocarbonyl hydrate. So this is the end product in the step 1. It undergoes the cyclization and deamination. Cyclization means you see here the structure undergoes the cyclic process, and deamination means the amine group is eliminated. See, NH2 is eliminated. So after the NH2 is eliminated and the structure is undergoes a cyclization process to form here 5 amino 2 mercapto 1 3 4 thiazole. So here in step 2, 1, 2 this thiocarbamyl hydrazine undergoes the cyclization and deamination process, means the amine group is eliminated to get the 5 amino 2 mercapto 1, 3, 4 thiazole. Next in step 3, the end product which came in the step 2 is the starting material for the step 3. See here 5 amino 2 mercapto 1, 3, 4 thiazole. So here undergoes the acylation process. See here in the amine group the acyl group is attached. C double bond O CH3 is attached here to get the intermediate product. So in the presence of the chlorine, here in the second position the chlorine atom is replaced to get the derivative of the 2 sulfonyl chloride. See here in the step 3, the 5 amino 2 mercapto 1, 3, 4 thiazole when it undergoes the acylation process. Here in the to the amide group, the acyl group is attached. In the presence of the chlorine atom, the derivative of the 2-sulfonyl chloride is formed. So next in the step 4, the end product of the step 3 is the starting material for the step 4. See here the derivatives of the 2-sulfonyl chloride when it is treated with the ammonia. So what will happen from the ammonia? One of the hydrogen molecule, and here one of the chlorine molecule will be eliminated in the form of HCl, and this remaining amine groups will get attached at the sulfur atom to get the drug acetazolamide. See here the derivatives of the 2-sulfonyl chloride when it is treated with the ammonia. Here one of the hydrogen and the chlorine atom will get eliminated to get acetazolamide. Next, pharmacokinetics. It is the oral route of administration. So it is the oral route of administration, and it means metabolized in the liver, and it is excreted through the urine in unchanged form. Adverse drug reactions are dizziness, lightheadedness, or increased urination may occur, and blurred vision, dry mouth, drowsiness, loss of appetite, nausea, vomitings, diarrhea, change in the taste, fever, skin rashes, impairment of the renal functions, depression of the bone marrow functioning. So depression of the bone marrow functioning means the bone marrow cannot able to produce the RBC cells. Next uses, it is used to prevent and reduce the symptoms of the sickness, and this is also used to decrease the headache, nausea, dizziness, shortness of the breath that occurs during the mountain climb. Means the persons those who will climb the mountain, no? So for that person it is used in the treatment of the headache, nausea, tiredness, dizziness, and shortness of the breath. And also it is used in the treatment of the glaucoma, means which is related to the eye infection, and metabolic alkalosis, seizures, edema, and also in heart problems. So use a dose for the edema, we should take the 250 to 375 mg, either maybe oral route or the intravenous route for the treatment of the edema, and also for the treatment of the acute mountain sickness. So means the person, those who are climbing the mountain, he may get the vomitings or headache or feeling of the tiredness or shortness of the breath. So for that condition, you have to take 500 to 1000 mg per a day. And in the treatment of the glaucoma, we should take 250 to 1000 mg per a day. Means based upon the tablets type, it is different level. For like intermediate release tablet, it should be taken 250 to 1000 mg per a day, or extended release capsules we should take 500 mg orally 2 times a day. Next, usual dose for the seizures. So we should take 8 to 30 mg based upon the body weight of the human. Should take oral route or the intravenous route of administration. Next, thiazides. So till now we have discussed whatever the drugs which comes under the carbonic anhydrase inhibitors. So what are the drugs? First drug is methazolamide. Next, dichlorphenamide, and next acetazolamide. So these are the 3 drugs which comes under the carbonic anhydrase inhibitors. So next one is thiazides. So thiazides, it is mainly present in the digital convoluted tubule, means it is also the part of the nephron. So in this part, that is digital convoluted tubule. So its main function is to inhibit the sodium and the chlorine synthase. So if the chlorine and the sodium symport will get inhibited means there will be the inhibition of the reabsorption of the sodium and the chlorine atoms in the body. So the main function is to inhibit the sodium and the chlorine symporters, then only the reabsorption of the sodium and the chlorine does not occur. See here mechanism of action. Here what will happen means, see here the chlorine atom is get eliminated and sodium atom is get eliminated. So if we replace the drug here in the body, what will happen means the reabsorption of the sodium and the chlorine atom will get stopped by inhibiting the sodium and the chlorine symporter. So if the sodium and the chlorine symporter functioning is inhibited means the reabsorption does not occur, means the reabsorption of the chlorine and the sodium does not occur, automatically it will eliminate it to the various parts of the nephron. See here, it will inhibit the sodium and the chlorine symport in the epithelial cells in the distal convoluted tubule. So that's then only it can inhibit the sodium chloride reabsorption in the distal convoluted tubule. Next, SAR, if you see the structure of the thiazide, at the second position, if you can see at the second position, the hydrogen atom is there. So what will happen means it acts as the acidic in nature and it will affect the neighboring sulfur group. So for this atom, what is the neighboring sulfur group? This is in the first position. So presence of this hydrogen group in the second position, it acts as the acidic in nature, so it will affect the neighboring sulfur group. See here in the seventh position, the sulfonide group is there, so it should be present for the activity of the diuretics. And if the acidic protons make the possible for the water soluble sodium salt, means it can be used for preparing intravenous dose. In the sixth position, the electron withdrawing group should be there for the activity. Next, the diuretic activity is enhanced by the substitution at the third position. See, in the third position is plays an important role for the activity of the diuretics. And in the sixth position, if the chlorine and the trifluoromethyl group is there, means it does not change any activity, but it will alter the duration of action, means it will changes the drug duration of action. Next, replacement of the chlorine atom in the sixth position means it will reduces the activity. So if the replacement or the removal of the sulfonide group means it will completely destroy the activity of the diuretics. See here, I will explain again SAR. In the second position of the nitrogen atom, if the hydrogen atom is there means it turns into the acidic in nature and it will affect the neighboring sulfur group. That is, in the first position sulfur group is affected. In the seventh position, the sulfonamide group should be essential for the activity. And if it is a water soluble means it can be easily prepared the intravenous dosing. And in the sixth position, if the electron withdrawing group is there means it is essential for the activity. And the third position is also essential for the activity. In the sixth position, if the chlorine atom or trifluoromethyl group is there means it will increases its activity. So if it is replaced with any other atoms like methyl, so if it is here methyl group is there means it will decreases the activity. And if we see here the sulfonamide group is replaced with any other atoms, or if it is completely eliminated means the drug completely loses its activity, means it does not show any diuretic activity. So this is the SAR. So in this first drug is hydrochlorothiazide, and this is the structure. IUPAC name is 6-chloro. 1 comma 1 dioxo, 3 comma 4 dihydro 2H, 1 comma 2 comma 4 benzo thiazine 7 sulfonamide. See, this is structure of the benzo thiazine. Benzo means benzene, thia means sulfur, aza means nitrogen. See here in second and the fourth position, two nitrogen atoms are there. So it is named as the diazine. So commonly known as 1 comma 2 comma 4 benzo thiazine. In seventh position the sulfonamide group is there. In the sixth position the chlorine atom. In the first position two sulfur atoms are there. So it is named as 6 chloro 1 comma 1 dioxo 3 comma 4 dihydro 2H 1 comma 2 comma 4 benzo thiazine 7 sulfonamide. So this is the structure of the hydrochlorothiazide. Next properties are, it is a white or practically white crystalline powder, and it is odorless but bitter in taste, soluble in ethanol, acetone, ammonia, and freely soluble in sodium hydroxide, dimethyl formamide, and sparingly soluble in alcohol, insoluble in ether, chloroform, dilute mineral acids. Next, pharmacokinetics. It is an oral route of administration and it is not metabolized but it is eliminated through the urine in unchanged form. And adverse drug reactions are blood pressure that lowers than the normal, means low blood pressure, dizziness, headache, weakness, and erectile dysfunction, and tingling in hands, legs, and feet. Next uses, it is used to treat in the high blood pressure, means it is used to lower the blood pressure that prevents the stroke, heart attacks, kidney problems. So if the blood pressure is high, means it is also affect the various body parts. So it will reduce the blood pressure, means we can able to save the all of the body part that is affected because of the raising of blood pressure, like strokes, heart attacks, and kidney problems. And also it is used to reduce the extra fluids in the body during the conditions like heart failure, liver disease, kidney disease. Means it is used to maintain the fluid balance in the body. And dose for edema 25 to 200 mg in maybe in the single dose, or the 2 divided dose in the oral route we should take. And for the hypertension 12 to 25 mg, it may be the single dose or 2 divided dose orally we should take. Next, hydroflumethiazide. Next drug is hydroflumethiazide, and this is the structure of the hydroflumethiazide. 6-trifluoromethyl 1 comma 1 dioxo 1 comma 2 comma 4 benzothiazine 7 sulfonamide. See here structure. This is the benzothiazine. So this is the benzene structure. Thia means sulfur. Diazine means two nitrogen atoms are there. Azine means nitrogen. So in second and the fourth position, the nitrogen atoms are there. So it is named as 1 comma 2 comma 4 benzothiazine. In the seventh position, the sulfonamide group is there. In the sixth position, the trifluoromethyl group is there. In first position, the oxygen group is attached. So the structure is 6-trifluoromethyl 1 comma 1 dioxo 1 comma 2 comma 4 benzothiazine 7 sulfonamide. So properties are, it is a white to cream colored, finely divided crystalline powders, odorless, and it is soluble in the dilute alkalis but unstable in the alkali solutions, freely soluble in acetone and insoluble in acids. So pharmacokinetics are, it is an oral route of administration and it is metabolized in the liver. It undergoes the urine excretion. So adverse drug reactions are low blood sodium or the potassium levels, imbalance in the sodium and the potassium in the body, low blood sugar pressure, high blood sugar, and sun sensitive skin means they can't able to expose themselves to the sunlight, nausea, vomiting, diarrhea, stomach pain, muscle cramps or the stomach cramps, loss of appetite, sexual problems, dizziness and fatigue. So next uses, it is used in the treatment of the hypertension and edema. Dose for the edema, we should take 25 to 100 mg. It may be in a single dose or two divided dose we should take. For hypertension, 12 to 25 mg we should take in one dose or the two divided dose in the oral route of administration. Next, cyclothiazide. So this is the structure of the cyclothiazide. An IUPAC name is 3-bicycloheptane 6-chloro 1,1 dioxo 3,4 dihydro 1,2,4 benzothiazine 7 sulfonamide. See here, this is a benzothiazines. Means this is a benzene. Thia means sulfur. Aza means nitrogen. Two nitrogens are there means, so it is named as diazine. So 1, 2, 4 benzothiazine. In the 7th position, the sulfonamide group is there. In the 6th position, the chlorine atom. In the 1st position, oxygen atoms are there. In the 3rd position, bicycloheptane is there. See, this is a cyclic structure, and these are two cycles. 1, 2, 2 cycle is bicyclo, and here 1, 2, 3, 4, 5, 6, 7. So 7 number is there. So it is known as heptane. See here structure. This is the structure of the benzothiazine. Means benzothiazine means 1, 2, 4 benzothiazine. For this structure, in the 3rd position, the bicycloheptane is there. Bicycloheptane. And in the 6th position, chlorine atom. In the 1st position, 2 oxygen atoms means 1, 1 dioxo and 3, 4 dihydro. In 2nd position, hydrogen. And in 7th position, the sulfonamide group is there. So next properties, it is a white to nearly white powder, and it is odorless, freely soluble in acetone, ethyl acetate, methanol, insoluble in water, chloroform. So it is insoluble in water and chloroform. So next pharmacokinetics are, it is the oral route of administration, and it is metabolized in the liver, and it undergoes the urinary excretion. So adverse drug reactions are dizziness, dehydration, salt imbalance, gastric irritation, nausea, vomitings, muscle cramps, diarrhea, jaundice, vertigo means also known as dizziness, headache, fever, respiratory problems. So uses, it is used in the treatment of the edema, hypertension, heart failure, nephrotic syndrome. And dose for the edema, we should take 25 to 200 mg in the single dose or two equally divided doses, that is to oral route. And for the hypertension, 12 to 25 mg, one or two equally divided dose should be taken oral route of administration. Next, chlorothiazide. This is the structure of the chlorothiazide, and IUPAC name is 6-chloro 1,1 dioxo 4H 1,2,4 benzothiazine 7 sulfonamide. See here structure. So this is the benzothiazine. So thia means sulfur, diazine means nitrogen. Two nitrogen atoms are there. So the structure is 1. In first position, sulfur 1, 2, 4. Benzothiazine. In 7th position, the sulfonamide group is there. In 6th position, the chlorine group. And in first position, the oxygen atoms are there. See here, 6-chloro, 1,1 dioxo, 1, comma 2, comma 4, benzo, diazine 7, sulfonyl. So next property, sir, it is a white crystalline powder and it is odorless, soluble in water, freely soluble in dimethylformamide, diphenyl sulfoxide, and slightly soluble in ethanol, pyridine, and insoluble in ether, benzene, and chloroform. Next, synthesis. So the starting material is 3-chloroaniline. See here in third position the chlorine atom is there. So it is 3-chloroaniline when it is reacted with the chlorosulfonic acid. Chlorosulfonic acid. Here what will happen is the water molecule will get eliminated and remaining the chlorosulfonic acid will get attached to the 3-chloroaniline to form 3-chloroaniline 4,6 disulfonyl chloride. See here, the chlorosulfonic acid get attached to the 3-chloroaniline in the fourth position and sixth position. So in fourth and the sixth position, the sulfonyl group is attached. So it is named as 3-chloro 4,6 disulfonyl chloride. In the present, when it is reacted with ammonia, what will happen means in the fourth position and the sixth position the sulfonyl chloride is there, no? So the chlorine atom will get eliminated. See here HCl. The chlorine atom will get eliminated. In the place of the chlorine atom, the amino group is attached in the fourth position and the sixth position. So 3-chloro 4,6 disulfonamide. So here what will happen means the chlorine atom is eliminated. In the place of the chlorine atom, the amine group is attached to form 3-chloro 4,6 disulfonamide. In the presence of formic acid, the structure undergoes a cyclization process to form the chlorothiazide. I will explain it again. The starting material is 3-chloroaniline when it is reacted with chlorosulfonic acid. So the water molecule is eliminated and remaining chlorosulfonic acid is attached to the 3-chloroaniline, that is at fourth position and the sixth position. So it is named as 3-chloro 4,6 disulfonyl chloride. In the presence of ammonia, the chlorine atoms will get eliminated and it is replaced with the amino group. So it is named as 3-chloro 4,6 disulfonamide. In the presence of the formic acid, the structure undergoes a cyclization process to form chlorothiazide. So this is the synthesis of the chlorothiazide. Next, pharmacokinetics. It is the oral route of administration, but it does not undergoes the metabolized, but it is eliminated through the kidney in the unchanged form. So it is the oral route of administration and it is not metabolized in the body and it is rapidly eliminated through the urine in the unchanged form, and it crosses through the placenta and does not cross through the blood-brain barrier, and also it is excreted in the breast milk, means the feeding mothers, the mothers those who feed to the children, no? So the breast through the breast milk it will get eliminated. Next, adverse drug reactions are dizziness, lightheadedness, feeling of fainting, headache, blood vision is not able to see properly, loss of appetite, stomach pain, diarrhea or constipation. So uses, it is used to treat the high blood pressure, means it is used to lower the blood pressure, to prevent the stroke, heart attacks, kidney problems, and also it is used to remove the excess amount of the salt and the water from the body. Means it is used to maintain the fluid balance in the body, and also it is used to decrease the swelling, that is edema, in such conditions of cancer, congestive heart failure, liver disease, kidney failures. So it is used to reduce the blood pressure and to prevent the stroke, heart attacks, kidney problems, and also it is used to maintain the body fluids in the body by removing the excess amount of the salt and the water, and also it is used to decrease the swelling. in the conditions like cancer, congestive heart failure, liver disease, and the kidney problems. And the dose for the edema 500 to 1000 mg oral dose, and for hypertension 125 to 250 mg it may be the single dose or equally two divided doses orally.